just ahead on Washington to Washington.
Here for your first vaccine?
We were really lucky in terms of COVID vaccine development.
How the development of COVID-19 vaccines went from research to reality, with the beginning of a possible return to normalcy now in sight.
A July 4th with your loved ones is the goal.
And state distribution struggles stemming from little federal guidance.
There wasn't a lot of, yours says this, everyone else says this, you should change it. There was a lot of leeway given.
What's now being done to pick up the pace of the largest mass vaccination campaign in the nation's history?
Meanwhile,
we want to get everybody who wants a vaccination vaccinated.
In Washington state, the task of getting shots in arms is easier said than done.
Patients, they want the vaccine. They're willing to do whatever it takes to get the vaccine.
And critics say the distribution process hasn't been equitable.
Community health centers see the most vulnerable people, the poorest of the poor, and we were not getting that location.
How is the state adapting its distribution strategy to address the challenges?
There's still vaccination happening in hospitals, but they're not the primary side anymore.
What does the future look like in terms of when we might achieve herd immunity?
Well, that's like the million-dollar question.
And how are some of the state's major companies playing a role?
There is a real common enemy here. It's a virus.
From the capital of Washington state
to the capital of the United States, this is Washington to Washington.
Hello and welcome to Washington to Washington. I'm Jennifer Huntley in Washington state.
And I'm Tammy Thuringer in Washington, D.C. We're starting our show in the nation's capital, where the federal government is working toward a goal of getting the country closer to normal by this summer, a goal that could become a reality thanks to the development of COVID-19 vaccines.
It's called Operation Warp Speed.
Last May, now former President Trump announced a partnership between the Department of Health and Human Services, the Department of Defense, and the private sector with an ambitious goal.
Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible. Again, we'd love to see if we could do it prior to the end of the year.
A COVID-19 vaccine by the end of 2020 seemed unlikely.
The quickest vaccine development was about 4 years. That was the mumps vaccine. But even that was unusual. So up until COVID, typically a decade, sometimes more, to develop a vaccine.
But it happened. Less than a year after the first U.S. confirmed case, Americans started getting the shots. Dr. Ruth Karen, one of the world's leading vaccine experts and director of the Center for Immunization Research at the Johns Hopkins Bloomberg School of Public Health, says platform technology is behind the rapid development.
The whole idea behind developing a platform is that you could be ready to put in what you need. The term of art that people keep using is plug and play, and that's really an oversimplification. It's not that easy, and there are some differences, but it is true that if you know something about how this program, this platform works, you can put in the piece of the germ of interest and then test it, and that development pathway is much quicker.
Both the Pfizer and Moderna vaccines, the first two approved, were developed using a platform called messenger RNA, or mRNA.
One of the things about mRNA vaccines is you can make them quickly. If you have the sequence, it was a matter of weeks from the time that we had the sequence of the Wuhan virus till we had, the first vaccination on March 16th. That was incredibly quick.
Researchers have been studying mRNA vaccines for decades, but the technology had never been approved for a vaccine against any disease. Dr. Karen says the years of previous work on the platform was vital.
We were really lucky in terms of COVID vaccine development.
Until now, most vaccines worked by introducing a weakened version of the virus into the body to stimulate an immune response and create antibodies. Dr. Karen says the successful use of mRNA vaccines could change how viruses are treated.
I was at the meetings in the fall of 2019 when we talked about mRNA vaccines as future technology in November of 2019. So these platforms, these technologies, I think you'll see many more mRNA vaccine candidates. And it's not to say that everything will work as well as I think COVID sets a very high bar. But I think it has really opened the door for using these kinds of platforms.
After the development phase, all vaccines undergo a series of clinical trials. Phase 1 clinical trials involve a small group of participants and focus on safety and dosage. Phase 2 includes several hundred people and looks at effectiveness and side effects. Phase 3 involves thousands of volunteers. It again looks at effectiveness plus monitors for adverse reactions. Each phase can take several months to several years, but the COVID-19 trials were 10 times bigger than typical trials. Dr. Karen says that allowed the safety and effectiveness data needed for approval to be generated faster.
We could have done a study of 5,000 people. It would have taken us probably 2 years or 3 years to get enough cases for us to know if the vaccine worked. And we didn't have that kind of time.
Last summer, the FDA issued specific guidelines saying any coronavirus vaccine would have to be at least 50% effective in preventing COVID-19 to move forward. The clinical trial results of the first 3 COVID-19 vaccines far exceeded that, but it didn't guarantee the vaccines would make it into the arms of the general public. In February of last year, Alex Azar, then Secretary of Health and Human Services, declared a public health emergency. That meant the FDA could grant an emergency use authorization, or EUA, for COVID-19 vaccines.
It's really a way to make life-saving medical technologies like vaccines available in a time of emergency before they've fulfilled all of the requirements that you would usually have for licensure.
Before the COVID-19 vaccines were considered for emergency use, the Vaccine and Related Biological Products Advisory Committee, or VRBPAC, reviewed the safety and effectiveness data from the clinical trials. Independent of the FDA, the committee includes scientists, public health experts, and academics like Dr. Karen, a past member who chaired the committee from 2006 to 2008.
Give a shout out to everyone who's sitting on VRBPAC this year, because we didn't have to look at EUAs.
VRBPAC meetings are always public, and like most meetings of the pandemic era, they took place virtually, streamed online, and carried by television networks. It's not unheard of for VRBPAC to meet and make recommendations on new vaccines, but it is unheard of for them to consult on whether a vaccine is safe for emergency use. According to FDA records, the first time was for Pfizer's COVID-19 vaccine. VRBPAC voted to recommend the Pfizer, Moderna, and Johnson & Johnson vaccines for emergency use, but Dr. Karen says it was just that, a recommendation.
The FDA is not required to take VRBPAC's advice, so they usually do, and they're not actually even required to consult VRBPAC.
The FDA did follow VRBPAC's recommendations and granted emergency use for the 3 vaccines. Despite not knowing which vaccines would be approved or guarantee any of them would be as effective as clinical trials showed, the federal government started purchasing millions of doses last summer. That allowed states to begin vaccinating people just days after approval. Jennifer, what did vaccine rollout look like there in Washington State?
Back here in Washington State, the rollout, like most of the country, has not been without its challenges. But there have also been early successes, like mass vaccination sites, some run by the state, others by local counties. We visited one in Puyallup that was run by the Tacoma-Pierce County Health Department, where thousands were vaccinated in one day. People like Carol Benson, who was thrilled to get her first shot. The disease hits close to home. Benson's 51-year-old son-in-law died of COVID-19 on Thanksgiving Day.
But you know, it was kind of a, I'm going to get it, I believe it, this whole thing, until we lost him. And that really, really brought it home. That, you know, it just wasn't going to be something simple or anything like that.
To get a sense of the effort to get people vaccinated, we spoke with the acting assistant secretary in charge of vaccine planning and distribution at the Department of Health. The conversation with Michelle Roberts gave us an inside look at the strategy from the start and for the future.
We're trying to vaccinate the entire state in, 6, 7, 8 months.
Working in public health, Michelle Roberts has seen and done a lot, including managing the state's child immunization program, making sure millions of vaccines are provided for children in Washington state each year. She's also worked at the CDC in Atlanta on HIV and STD prevention efforts. But this past year and this pandemic has proven to be her biggest undertaking yet.
Yeah, it's been really one of the most challenging times of my career, but really also really mission driven and really fulfilling.
In the beginning stages of planning, health officials looked to the past at the most recent large-scale pandemic, the H1N1 virus in 2009.
We started looking about what worked then, how were we staffed, what were some of the lessons learned.
They also looked to the childhood vaccine program, an existing public-private partnership that provides 3 million doses of vaccines each year to kids under age 18. But even that didn't match the scope of this massive vaccination effort.
We needed to really build that capacity way beyond that if we're going to be able to reach our goal.
The goal was to deliver 45,000 vaccines a day, a target reached by the department in early March.
What is different from just the flu vaccine, which people get every year?
The flu vaccine is given over maybe 10 months or so, starting in August and September and all the way through June each year. So that's a longer time period. And in that time period, about 50 to 55% of our population gets vaccinated. So we're trying to get a bigger percent of our population vaccinated in a quicker time period.
Unlike the flu vaccine, which is usually given at doctors' offices or pharmacies, the department planned a multimodal approach to distributing COVID-19 vaccines.
We need to make sure there's vaccines at employer workplaces, pharmacies, your healthcare provider, but really also looking at strategies like mass vaccination, community pop-up clinics, mobile clinics to reach kind of our seniors most at risk who maybe can't get in to a clinic. So all kinds of strategies like that to really accomplish the scale of what we're trying.
In the beginning, the state relied on hospitals to distribute vaccines. That prompted criticism since hospitals didn't have the infrastructure to coordinate appointments.
We want the healthcare system to be ready for us. So that really, one of the most important pieces was preserving capacity in our hospital system. And so those were some of the groups of people first eligible. And so that's why we distributed vaccines through the healthcare system and largely hospitals in the beginning.
They've since enlisted the National Guard to help at mass vaccination clinics and expanded distribution to a number of outlets, including community health centers, where some of the most vulnerable to COVID-19 will most likely get their vaccine.
We have a map called the Social Vulnerability Index, which really uses existing data on about our communities, about where COVID disease is, to really help identify where were the locations where the risk is the highest in the state. And how are we making sure that vaccines are going to providers in those locations, in those communities?
What should the federal government in particular be doing differently to support states going forward? What would be the most critical way that they can support your efforts?
Immunizations have been flat funded for 10 years or more federally. And so money is flowing now, but this is every time we think, do we have enough infrastructure? There's more that's needed. There's new gaps or challenges that are identified.
As for lessons learned for the next pandemic, Roberts says a strongly funded public health system at all levels is critical.
We know that we need relationships and capacity and other pieces to ready to go so we can hit the ground running in the next emergency.
The Washington State Department of Health is getting assistance in the form of corporate support. Some of the biggest companies in the world are headquartered in this state, and they have offered to help in a new public-private partnership.
There is a real common enemy here. It's a virus.
Every day, at the start of his day, Dan Laster is on a conference call.
7 o'clock is a 15-minute command center call to try to get everybody on the same page.
On the line, besides the State Department of Health, are executives from some of Washington's most high-profile companies, eager to help with the latest pandemic conundrum, how to get a vaccine into the arms of millions in our state faster than ever before. Facing supply chain logistics that even Amazon would shudder at, Laster is the director of the new Vaccine Action Command and Coordination System Center, or VAX for short. His job, to tap into the resources of the private sector to support distribution efforts. And he is not above making World War II era comparisons.
I think it was probably the second or third day that I quoted Winston Churchill from 1942, that we are at the end of the beginning.
On board already, Amazon, Microsoft, and Starbucks, to name a few.
When I heard that Starbucks was getting involved or some of these other corporate entities, but I thought of, I could drive up, I could order my latte and get my vaccine, a shot in the arm. How are companies like Starbucks in particular helping with this partnership?
They are really par excellence in terms of the customer experience.
In fact, shortly after the public-private partnership was announced, Starbucks teams descended on one of the state's first mass vaccination sites in Clark County, studying the traffic flow. Within weeks, they presented the results to DOH and gave concrete ways to improve, such as adding a third line to increase the number of vaccinations by as much as 30%.
One of the things that was discovered through the Starbucks work was that 15 minutes that everyone has to sit, that was kind of dead time.
So Starbucks suggested the Department of Health create a video for people to watch after they get their vaccine, reminding everyone they still need to social distance, wear a mask, and wash hands. As for how the partnership is supporting access to the vaccine for minority communities,
equity is infusing everything we do.
The vaccine locator tool is now available in 11 languages. Amazon is helping increase the capacity of the state's call center, a resource for those without reliable internet to schedule vaccine appointments.
Does that mean that Amazon is going to actually provide technology and staffing for this?
Amazon Connect is a call center technology with people. So there are volunteers that will be actually handling calls.
It's this kind of work that Laster relishes. As a former chief legal officer and chief operating officer at the global nonprofit Path, he sees the value in bringing people together to solve a problem here that communities all over the world are also facing.
My role is curating. It's twofold. On the public sector side, it's surfacing the needs, and I'm really trying to push my colleagues to speak more in terms of problem statements, because by speaking in terms of problem statements, then when I turn and pivot to the private sector, we can speak in terms of private problem statements and may come up with an even better innovative solution.
Kaiser Permanente, CMAR Community Health Centers, and SEIU 1199, the Union for Health Workers, are also all involved in the partnership with the state. Tammy?
When the vaccine rollout started in December, the federal government's plan was largely to leave distribution to states. Some, like Washington, have seen success, but the hands-off approach also created hurdles. Still ahead, we'll look at efforts to increase coordination and how the federal government is expanding distribution as supply ramps up. Welcome back to Washington. When COVID-19 vaccines started rolling out of warehouses in December, the federal government took a backseat to states, leaving it up to them to distribute. But after a slow and bumpy start, they're taking a different approach.
The federal government's not going to fix this alone, nor are the states going to do it if you just leave them on their own without any help. What that's going to be is a cooperation and a collaboration and a synergy between the feds and the states.
That was Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, and a member of both President Trump and President Biden's COVID-19 response teams, acknowledging the problems just 6 weeks after vaccines started going to states. Better collaboration with the federal government is something state and local health officials need.
We've continually brought up that there needs to be more national planning and more of a national plan across the country. To get us through this, we really need to have that central, what's the vision? How are we doing this? What are some of the baseline parameters to make sure that there are consistencies across that response?
Adrienne Castellotti, Chief of Government and Public Affairs for the National Association of County and City Health Officials, says initial rollout challenges partly stemmed from the lack of guidance and feedback states got on their distribution plans.
There wasn't a lot of, yours says this, everyone else says this, you should change it. There was a lot of leeway given.
Now, months into the distribution, Castellotti says there's been some improvement.
Last year, we were unable to get one call that had every single local health department leader invited to. Now we have weekly-ish calls with the administration, which is great to make sure that we're hearing firsthand from them what's going on, but more importantly, that they can hear back from people who are doing this on the ground. What are some of the challenges? What are some of the things that they need?
Castellotti says there's still a long way to go and noted a handful of things the federal government could do to help, including better communication and coordination across all levels of government, data support to help ensure equitable distribution, and making sure people are educated on the vaccines.
What does it mean that we have 3 different types? Where can they go? What does prioritization mean, and why we're asking people to get whatever shots available to them when they're eligible?
According to Castellotti, there's already been improvement on the issue of supply predictability.
The federal government has started to provide more leeway in times of how many, when what vaccine is going to come down the pike. So now you have 3 weeks of visibility at the state level.
That's good news for state and local health departments, but the federal government is now also bypassing them. In February, the Biden administration started shipping an additional dose allotment directly to federal pharmacy partners across the country.
This will provide more sites for people to get vaccinated in their communities, and it's an important component to delivering vaccines equitably.
The pace of vaccine production has also picked up, thanks in part to the Defense Production Act. The Korean War-era law allows presidents to direct private companies to prioritize orders from the federal government. The Trump administration invoked the DPA more than a dozen times, and in March, President Biden used it to help pharmaceutical giant Merck secure the equipment it needed to produce Johnson & Johnson's vaccine. That agreement pushed up the previous vaccine production goal by months.
We're now on track to have enough vaccine supply for every adult in America by the end of May.
It's unknown how long it'll take to get those doses into arms, but as Jennifer mentioned, the National Guard is helping speed things up. And more good news, President Biden has directed FEMA to fully reimburse states and local jurisdictions for the use of National Guard troops for the COVID-19 response.
In Washington state and places across the U.S., statistics show that minority communities are disproportionately impacted by COVID-19, with higher rates of infection and deaths per 100,000 people. The challenge is how to get vaccines to those communities hard hit by the virus.
Good morning, number 18, número 18.
For more than 40 years, Rogelio Riojas has served as president and CEO of CMAR Community Health Center. It's grown from a single medical clinic in Seattle's South Park neighborhood into a comprehensive health and human services organization with 34 clinics serving communities throughout the state of Washington. Communities that are often left out in access to health care.
Yes.
Community health centers see the most vulnerable people, the poorest of the poor.
Riojas has seen firsthand how communities of color have been disproportionately impacted by COVID-19. That's why CMAR requested access to vaccines early on.
Community health centers should have been given an allocation back when they started, back in December.
When they did start getting vaccines, they set up a system different from other healthcare centers. Instead of signing up online or with a phone call, people line up outside the clinic on the day vaccines are available.
The way we're doing it, I think, makes a lot of sense, is working, and it's working for people of color. I mean, probably about 40% of our patients are people of color, versus the state, I think, is like 4%. And so it makes a difference in terms of the system you're using to get the word out to the community.
On the day we visited,
Number 7.
the vaccines were already spoken for by the time we arrived at 7 a.m. That's because people lined up in the middle of the night to sign up for one of the coveted 100 spots available that day.
Because patients, they want the vaccine.
Clinic manager Sam Romero is often the one showing up in the middle of the night to take names and tell people to come back for their vaccine when the clinic opens.
It's hard to tell patients, we're all out of vaccines. We're done for today. And then they ask, well, what can I do next? How do I get the vaccine? And we're sitting there, we're not sure. We don't know when our next vaccines are coming.
Riojas says CMAR clinics have the ability to vaccinate up to 20,000 people a week. A federal program by the Biden administration that began in February allowed community health centers to apply for vaccines directly, cutting the state out as middleman to speed up access.
Every week that we experience something new, let's try something different.
Clinic executive Jesus Sanchez says CMAR is positioned to provide help and hope to communities hardest hit by this virus.
The majority of the people are out in the communities, and we have capacity at boots on the ground, as you say, with all the clinics. We have capacity to do with home health care. We can go into their homes and give vaccines for those that are frail and can't get in. We have a mobile clinic capacity to reach out to the farm working community.
For Riojas, this experience is a reminder of the value of the community health center, a value he believed in more than 40 years ago that is having even more impact today.
We're going to do our part. I think all community health centers are going to do their part.
Here in Washington state, the story is similar to one in communities across the nation, from local governments to the private sector to a neighbor helping an elderly person sign up for a vaccine. Never has it been more critical for people to work together to end this pandemic. Tammy?
Thanks, Jennifer. President Biden also called for unity during a speech on the one-year anniversary of the pandemic.
I need you to get vaccinated when it's your turn and when you can find an opportunity. and to help your family, your friends, your neighbors get vaccinated as well. Because here's the point. If we do all this, if we do our part, if we do this together, by July the 4th, there's a good chance you, your families and friends will be able to get together in your backyard or in your neighborhood and have a cookout or a barbecue and celebrate Independence Day. That doesn't mean large events with lots of people together, but it does mean small groups will be able to get together. After this long, hard year, that will make this Independence Day something truly special, where we not only mark our independence as a nation, but we begin to mark our independence from this virus.
Thank you for joining us for Washington to Washington. We look forward to continuing our focus on the critical issues in this state.
And talking with people in both places who are working towards solutions. We welcome your feedback on this episode as well as ideas for future episodes of Washington to Washington.
Connect with us on social media at WA2WA and share your thoughts.
For now, from Washington, D.C., thank you for watching.
And from Washington State, we hope you'll join us next time on Washington to Washington.